To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we're going to talk about the differences between private practice and institutional medicine. To help us do that is our friend Dr. Delo from Delo Sports Medicine. Hi, doctor.
Hello.
I wanted to have you on to talk about the differences here, but maybe we'll start with what led you into a private practice model.
Okay. When I first got out of medical school, I was really satisfied with the autonomy that a hospital employment allowed. It allowed me to build my practice the way that I thought best for myself, and to treat my patients the way that I thought was best for them. However, I think we've all seen over the past 10 years or so this corporatization of hospitals, these mergers, these takeovers by healthcare MBAs and administrators who are going in and try to micromanage these medical practices, which isn't best for most physicians and most patients.
Yeah, and that's why I wanted to talk about it as patient care changes. As it relates to your practice, have you found sports medicine be successful in that private practice model?
So I've only been out for 3 years, but so far, yes, and I have colleagues across the country who have gone private for similar reasons. My specialty doesn't fit in well with kind of the box model of the hospital because I do offer things outside the box like regenerative medicine and minimally invasive orthopedic procedures, and I get a lot of referrals for really difficult diagnoses, and so it does work well with private practice space.
And it really kind of goes to patient care on that. So let's then maybe double down on more benefits that a patient could see by visiting somebody like you in private practice.
Sure. Well, there's lots of studies that have been done that show that there is increased patient and provider satisfaction in a private practice model. Patients spend a lot more time with their practitioner than they otherwise would. The cost is actually lower, and they've shown that the physician-patient relationship is maintained, which actually leads to better compliance with treatment protocols.
More time with your doctor helps that relationship. You get to know each other. And then last, I'd love to get your opinion. Where do you see healthcare going into the future?
Well, obviously, I think we all know, especially since COVID, that the hospital system or the medical system is broken. So there's going to have to be changes. What we're seeing right now is more and more practitioners moving into the private practice space, and also employers looking for less expensive healthcare for their employees outside the big insurances and the big hospitals. So I think there is going to be a trend that way.
Yeah, patient care, less cost, it all works. All right, well, Dr. Delo, thanks so much for this great information, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.